How do Medicare, Medicaid, and private insurance compare for stroke? When it comes to stroke care, the type of insurance you have can really influence your treatment options, recovery, and overall outcomes. Private insurance often provides quicker access to advanced treatments like surgical interventions and specialized rehabilitation. Patients with private coverage tend to have shorter hospital stays, fewer complications, and better survival rates during their hospital stay. They are more likely to receive therapies that can improve recovery, such as clot removal procedures or intraarterial treatments, which are crucial for restoring blood flow in certain types of strokes. Medicare, which primarily covers people over 65 and those with certain disabilities, tends to have higher in-hospital mortality rates compared to private insurance. Older patients often have more health issues, which can make treatment more complex. They are less likely to undergo some surgical procedures, possibly due to age or other health factors, and may experience longer hospital stays. Despite these challenges, Medicare provides broad coverage for stroke treatments, but the outcomes can be affected by age and pre-existing health conditions. Medicaid, which supports low-income individuals and families, often involves longer hospital stays and less access to the most advanced treatments. Patients on Medicaid tend to have worse outcomes and higher readmission rates after a stroke. They are less likely to receive intensive rehabilitation services, which are vital for regaining function after a stroke. Instead, they might be placed in less intensive settings like nursing homes that may not offer the same level of therapy, potentially impacting recovery. Uninsured patients face the greatest barriers. They are less likely to get timely or advanced treatments and often experience worse health outcomes. Without insurance, access to rehabilitation services is limited, which can hinder long-term recovery. Emergency services are still available regardless of insurance, but the overall quality and extent of care can be significantly affected. For those who qualify, dual eligibility for both Medicare and Medicaid can offer additional benefits, such as coverage of certain services not fully covered by Medicare alone. However, even with these benefits, outcomes can still be worse compared to privately insured patients, partly because dual-eligible individuals often have more complex health issues. In terms of recovery, having good insurance coverage generally means better access to post-stroke rehabilitation, which is essential for regaining independence. Patients with private insurance are more likely to access intensive rehab programs, including inpatient and outpatient therapies, which are linked to better functional outcomes. Medicaid patients may receive less intensive care, often in less specialized settings, which can slow recovery. Uninsured patients are at a significant disadvantage, often missing out on essential post-stroke therapies altogether. Understanding these differences helps caregivers and patients make informed decisions about stroke care options. It's important to remember that individual experiences vary, and medical professionals should always be consulted for personalized advice. Insurance coverage can influence not just immediate treatment but also long-term recovery and quality of life after a stroke. Always seek guidance from healthcare providers to determine the best course of action tailored to each person's unique needs.